Kasha. I'm Susan Regan. I'm the lymphedema therapist that will be seeing you this afternoon. The doctor sent you because you're having some fluid accumulation in your arm. And so what we're going to be doing is we're going to start by taking some measurements. I'm going to explain to you some of the things with lymphedema. We'll compare your sides so that we know when we're making progress with your therapy, okay? Okay, so what I'm going to do is I'm going to take a couple measurements. We just use a standard tape measure, and we're going to be putting this around your hand. And then this will give me something to look at in the future to be able to compare. And then we'll come up the rest of the arm every 4 centimeters to be able to take the measurements. And we'll do both sides. The next thing we have to talk about is we do some different strokes with the lymphedema manual drainage. We have one stroke that's called a pump. We have one stroke that's called a rotatory, dynamic circle, and then we have the rotations. And what we're trying to do is we're staying very close to the surface of the skin. The lymph drainage is right at the top of the skin. If we go too hard, we can actually damage the lymph nodes. So what it's doing is we're going to retrace where the lymphatic drainage is going to try to get it out of your arm and take it to your other lymph nodes that aren't affected in your body. So it should be very relaxing, very soothing, and the whole goal is to take the edema that you're having out of this arm. In the end, what we end up doing is we want to bandage you. Sometimes this can feel a little cumbersome, but it's to be able to get pressure on those lymph nodes so that when you exercise and do your activities around the house, it's going to help to take that edema down further. You're not going to have to wear this all the time for a long time because we'll put you into a compressive garment in the future. But I'm going to start the wrapping, and I want you to watch this because this is some of the stuff that you'll be doing at home also when we first initiate this, once we teach you how to do this. So we're just going to take the bandage up onto the finger. With the fingers, because you use them all the time, we don't want to cover your nail bed there, and we're just going to go right around, and we're going to keep the palm open at this point. And you're going to be able to move your hand and use it for everything that you need to be doing at home. Now, if we find there's areas that we have a lot of swelling, we may need to put some foam in to be able to have it help to take the edema down, because what happens is when you get a buildup of that edema, you can actually have scar tissue that starts to form. So what's going to happen is this is going to come up around your hand. And this is going to cause compression so that when you're exercising, it's holding everything in a good position, because what this does is it creates a strong working pressure, but a low resting pressure, which means that it's not going to feel uncomfortable when it's on you and you're just resting. But when you're exercising, it's going to cause a force to be able to react against the muscle to try to further reduce that swelling that you have going on in your arm. Okay, now we're going to start with this next bandage. This one is going to start to come up the arm. And again, this part of the arm looks really good. It's probably that upper arm that we have to work on a little bit more, but we want to have enough pressure so that you don't have problems and have swelling at one area. If we go and we don't put any bandaging down here and we only bandage the upper arm, it's going to cause all of the edema to come down into the lower arm. Okay?